Hey everyone, welcome back to the channel where we dive deep into the real stuff going on in our heads. Psychology made simple, no fluff. Today, we're talking about something that's blowing up right now. Google search trends for mental health across the USA, UK, and Canada. People are typing in anxiety, depression, therapy, and even AI for mental health like never before. And the data shows why 2026 is a turning point. I've pulled the latest reports and trends to break it down for you step by step, country by country, and what it all means for everyday folks like us. If you've ever felt that quiet stress building or wondered why everyone seems on edge, this is for you. Let's unpack it together. Start with the USA because that's where the numbers are hitting hardest. Recent health reports from late 2025 show that telehealth for mental health exploded. 62.3% of all online therapy claims in early 2025 were for conditions like anxiety and depression. That's millions of people ditching the waiting room and jumping on apps instead. And get this, Google searches for depression-related terms have climbed 67% from 2010 right through to now, peaking every winter and early spring when the days get short and that seasonal slump kicks in. It's not random. Integrated care in regular doctor's offices saw 66.4 million behavioral health visits in 2024 alone, more than some primary care stats. Workplace burnout is sneaky too. Folks are hiding it behind productivity, but political stress and AI tools entering emotional support are stirring things up. Think about it. If you're scrolling late at night feeling empty or guilty, you're part of a massive wave. Trends prove searches for insomnia, fatigue, and feeling sad follow those exact patterns, higher up north where winters bite harder. This isn't hype, it's real data showing people want help now, quietly from their phones. Now shift over to the UK. Similar story, but with a tech twist that's fascinating. Searches there are spiking for AI in psychology, like chatbots delivering support and personalized interventions tailored just for you. Dissertation topics and research hot lists from late 2025 highlight how digital tools boost cognitive training, emotional regulation through virtual reality, and even ethical AI for predicting mental health risks. Social media's role is huge too. Kids and young adults are searching how it messes with motivation and goal setting, chasing celebrity perfection that leaves them drained. Data-driven psychology is booming. Big data for behavior patterns, tailored feedback to fight anxiety and depression. It's like the UK's saying, we know tech broke some minds, but it can fix them too. If you're in the UK grinding through self-tracking apps or wondering about online CBT customized to your life, those searches aren't alone. Trends mirror a push for sustainability in mental care and diverse approaches that fit real lives. Canada's numbers hit close to home, and they're tough to hear, especially for the younger crowd. Stats from early 2026 confirmed generalized anxiety disorder doubled from 2.6% in 2012 to 5.2% in 2022, and major depression jumped from 7.6% over the same stretch. Youth mental health? About 20% of Canadians under 25 deal with a mental illness, with kids rating their health as fair or poor doubling from 12% in 2019 to 26% in 2023. 1 in 3 young adults aged 18 to 24 hit moderate to severe depression last year, and 1 in 4 the same for anxiety. It's worse for 2S LGBTQ+ youth. 1 in 4 had suicidal thoughts recently, compared to 5% for others, and 56% met criteria for a disorder. Transgender stats are stark. 77% in Ontario have seriously considered suicide. 45% attempted it. The pandemic sped this up, but demand for services is outpacing supply. Trends follow suit. Loneliness, self-harm, and abuse terms track real declines in some self-reports, but overall, it's a call for early talks and better access. So why do these trends matter across all 3 countries? They're screaming that mental health isn't a solo battle anymore. It's a shared crisis, shaped by tech, work, seasons, and screens. In the USA, virtual care opens doors for neurodivergent folks who need sensory control. UK's personalization means apps that actually get you, not one size fits all. Canada's Youth Alert pushes family involvement and preventative steps. The common thread? Searches stabilized or even rose even as some distress dipped post-peak pandemic, showing people seek answers before hitting bottom. And here's the hopeful part. You don't need a therapist tomorrow to start. Track your mood daily with those trending telehealth apps. Simple journals cut through fatigue. For anxiety, try AI-guided breathing exercises. UK data backs their edge on emotional regulation. Walk outside when winter blues hit. USA trends show it flips seasonal dips. Talk early if you're young like Canada's stats urge. Intervention slashes risks big time. Real talk from someone who's seen it? A buddy ignored his empty feelings during a dark month. Trends showed millions do the same, but 5-minute daily check-ins and a quick virtual session turned it around. No magic, just consistent small moves. This data isn't guesswork. It's from health reports, trend analyses, and population studies painting the same picture. 2026 demands we pay attention. What's your story? Which trend feels real? Drop it in the comments, smash like if this clicked, subscribe for more breakdowns like this every week, and share with someone who needs the nudge. We've got your back. Stay curious, stay talking, and take that first step today. Catch you in the next one.